Thank you all for joining us this afternoon. This is our second webinar lecture with the Academic Health Department. This is a partnership between the Jiann-Ping Sioux College of Public Health and the Coastal Health District. We're hoping to become more and more active, so stay tuned for more activities with our Academic Health Department. We are really excited to have Dr. Aslan here today. She is the director of the Institute for Water and Health here at Georgia Southern. She's currently an associate professor of environmental health sciences, and as I mentioned, the director of the Institute for Water and Health. She is an environmental microbiologist by training, and her research area is at the intersection of environmental health, coastal water quality, and water resource management. She has 20 years of academic experience in water and health research and served as principal investigator in several national and international projects. Dr. Aslan has been serving in various state and federal agencies and organizations as an advisor, reviewer, scientific committee member, and affiliated faculty. She is currently serving as the co-chair of the Water and Health Committee of the American Public Health Association and the U.S. EPA Science Advisory Board for Drinking Water Contaminant Candidate List. So welcome. Everyone, if just a few housekeeping things, we are recording this lecture. Please keep your microphones muted. If you have a question, feel free to put it in the chat, and then after the lecture is over, we will, of course, open it up for questions. So, all right, welcome.
Good afternoon, everyone. So great to see everyone. Today, I'm going to be talking about our new Institute for Water and Health. It's been a year since our establishment, and I'm going to be talking about some projects that we have been doing at the coast. As you know, coastal Georgia is a very precious place. When I first was interviewed in 2013 and flying over Savannah, that's what I saw. There's so much to do in terms of water quality and health here. We have beautiful beaches, we have 3 major river basins, and a lot of activities, both tourism and industrial. So there's a lot to do here. This is also one of the fastest growing populations in Southeast Atlantic, as you may have seen in the news too. There's a lot of economical boom happening in this region. We already have paper mining and manufacturing and tourism in this area, along with fisheries and having the nation's 3rd largest port. When it comes to water resources, this area is particularly important because it lays about the Floridian aquifer, a water body that's been shared and used by multiple states in the region. And Georgia's primary drinking water is this Floridian aquifer, which we will be talking a lot during my talk today about potential threats on this aquifer. The area is also important with its 16 major beaches that receives more than 5,000 people over the summer, and also a great place for fishable waters and recreational activities in terms of fishing and also aquaculture. This region is also, as you know, one of the highest poverty rates in the nation, and with a 65% lacking college degrees. That means that there is a lot going on in terms of environmental justice and equity as well. So, as Georgia has been a great source for water resources, it also has a lot of issues related to water. Like I said, there's the increased water demand related to increased population, but we have a lot of houses that are have been built almost 100 years ago. A lot of aging water infrastructure in our housing systems, our plumbing systems, and wastewater systems. Along with that, we have been seeing a lot of issues related to climate change, sea level rise, meaning that salt water is coming into our very precious drinking water resources, which is our Floridian aquifer. All of these issues is really mostly impacting the vulnerable the most. Underserved communities, people with immunocompromised health, and all impacted by these issues the most. So all of this really came up to establishment of this Institute for Water and Health. Our mission here is to unite science, practice, and community funds of knowledge for a collective vision of safe water, sustainable environment, and resilient communities in coastal Georgia and beyond. This is our website. We have been doing a lot of interesting projects in the last year, and I'm going to be talking a little bit about those. This is our team. We have coordinator for community engagement and outreach, Luke Robertson. He has a Master of Science degree, also has been an adaptive wetland coordinator of UGA for many years. Now he is also a doctoral student at our college in community health. Victoria Clover is our graduate assistant. She is also a community health doctoral student as well. Timothy just joined us a couple of months ago. He has a Bachelor of Science in Computer Sciences and also a graduate assistant and doing his master's in biostatistics. Reese Schumacher is our undergraduate researcher, and she is also a computational scientist, and she is aspiring to be a part of the team moving forward and hopefully doing her graduate studies with us. These are some of our programs that we have been developing and moving forward with. We are doing a lot of research in terms of applied research and innovation. We have many partners related to water resource management and water quality and education as well. I'm going to be talking a lot today about the rapid response research activities that we have been doing, because for us, it's absolutely very important that research has to be connected with the communities and communicated. And most of the research that we have been doing is actually originated from our conversations with our communities in the region. We also support student research. This summer, the Institute housed 2 of our summer interns that has done their practicum with us, and we are planning to move forward with that activities as well moving forward. Since last September, we have been doing a lot of meetings, expanding our existing networks, working with the groups that are in the water and health area. Some of these are external, some of these are internal. We have a great group of people here in Georgia Southern that does research around water. Some of them are in College of Education, some of them are in College of Social and Behavioral Sciences, Public Health, Environmental Engineering. We have been meeting and brainstorming about research projects, have been writing grant proposals together. This was already an established network, but we're just growing, and we are open to increase our research network moving forward as well. We also have partners from state agencies. We have been working with Georgia Environmental Protection Division on certain projects, along with the DNR as well. We do have laboratory activities going on in our College of Public Health through our research. We are also fortunate enough to also expand our research portfolio and research resources in Savannah. Right now, the Savannah water laboratories are being renovated at the old Georgia Bureau of Investigation laboratories. This will be a 6,500 square foot laboratory with the capacity of an environmental microbiology, biosafety level 2, and a water chemistry laboratory, along with other laboratories that other colleges are also renovating as well. Some of our research grants has been in collaboration with other colleges and our partners from College of Public Health as well. One of the projects that we are currently working on is a funded project that primarily looks at the availability of water in the coastal Georgia.
Yes,
have been-
have a good week. I'm sorry for the tennis.
We have been partnering with Coastal Georgia Water Resources Planning Council. This is one of the 9 councils in the region that specifically looks at the water resources. And it covers 11 counties at the coast. The goal of this project is to identify the areas where water demand is needed most and how current policies are actually working or not working in terms of water conservation. The map here you see is our initial locations of the dashboard that we're developing. That looks at the red zones on coastal Georgia, meaning that these areas are no longer allowed to open up new private new wells, meaning that no more drinking water can be extracted from additional wells in these regions. And we're using a US Geological Survey's well data to see how this water has been fluctuated over time, and if these policies actually worked to keep the water resources available and sustainable for future. The data goes all the way back to 1940s, and we're working with College of Engineering faculty to see how this water will be looking like in the future, doing some more predictive modeling towards that. So this is one of the projects that we have been working on as an example of how we actually can look at the current policies and how that impacts water use in the region. Another project that we have been working on is, again, working with the communities, especially with the industrial communities, industry, to look at how paper mills actually impact water quality in the region. Paper mill wastewater is actually one of the hardest to treat. When it goes into the environment, the chemicals that comes from that treatment actually can be persistent in the environment for a very long time. This EPA project that just got funded this August actually is going to be looking at how can we improve the existing wastewater treatment technologies using food waste from universities, because university campuses actually use and create most of the food waste in the nation. If we could use that food waste to improve some of the anaerobic digestion as a treatment method, can that actually be used better for treating the paper mill wastewater? So that's what we're looking at for that. This will be a 2-year project that supports 3 students, and also working with the paper mill industry and also the communities in Statesboro as an example will be important for us. One of the unique studies we have been doing with the communities is also related to sustainable wastewater management. If you have ever visited Statesboro wastewater treatment plant, this is one of the places that is absolutely a great educational experience for how our wastewater actually ends up in the environment. They have been doing a great job in treating their wastewater. They're ready for the next 15, 20, 50 years with the increased population as well. But they are also very open to innovative approaches. So this is the first, to our knowledge, the first wastewater treatment plant in the nation that allowed us to use another technology to see how their wastewater effluent can be better treated. We're using a sustainable system. It's called algal turf scrubbers. We're using natural algae from the river system to grow on the effluent of the wastewater and see how that the potential contaminants that may come out from that effluent will be treated using these natural algae. Now, a lot of our wastewater treatment plants in the US has been developed in 1970s with the technology of 1970s. They're working good, but they can work better, especially when it comes to emerging contaminants like PFAS, like pharmaceuticals, like antibiotics. They're not designed to remove those, but because back then, the only importance was on fecal bacteria or diseases related to microbes. So this technology is that we're actually using here is to see whether we can remove these contaminants with these nature-based solutions. Because at the end of the day, we don't want to add anything foreign to the system. So using this natural system could work. Our initial results we just first started focusing on antibiotic-resistant bacteria and if we can remove any antibiotics from the system. Our initial results is showing about 49% of reduction of antibiotic-resistant bacteria using this system. So we have been applying to grant proposals. We have been collaborating with wastewater treatment plants, farmers in the nation to see how else we can actually use this and leverage this technology. One of the things here in the Institute we also do is leveraging modern, new, rapid testing methods. When I first started my postdoc years ago, QPCR was the new technology. It's been a long time, and today we all know about QPCR thanks to COVID, because that is a method, a molecular method that can very quickly identify whether somebody has COVID or not. This technology initially was developed for environmental testing for beach monitoring years ago, because EPA got sued for using 1900s methods, which are culture-based methods. Originally, if you, and still many places use that, if you collect water sample and try to identify if there is any pollution in water, all you do is filter that water and grow them on some agar plates. That takes at least 18 to 24 hours, meaning by the time the public is informed, it's already too late, because you're already too late in informing. Now, molecular methods actually can detect and report within 4 hours of sample collection. That really helps, because now we're talking about same-day reporting. It's great for outbreak response. It's great for beach water monitoring, where people go and enjoy the beach. They actually know that that water is tested that this morning, not days ago, 2 days ago sometimes. So we have been using that for beach monitoring quite a bit of a time. In Michigan, when I was doing my postdoc, that was the method that we actually worked with the public health departments to bring that method to the health departments, train them on the method, got some EPA funding, and now they have 17 public health laboratories actually can implement QPCR by themselves. When COVID happened, Michigan was one of the places where QPCR testing easily converted to COVID monitoring. So we have been trying to bring that in Georgia as well. We have been working closely with Department of Natural Resources to see if we can use this also for beach monitoring as well. One of the projects that we did, and that's actually a great collaboration between public state agencies and academia, has been that Kings Ferry beach study. This was an area where it's an inland beach. It was under permanent advisory, meaning lots of bacteria, E. coli bacteria that didn't really necessarily showing a particular source, whether it's human or animal, has been there for a very long time. And because there are high levels of bacteria, Department of Natural Resources closed that beach, put a permanent advisory on that beach for a very long time. We used QPCR as a method to detect the sources of these pollution, to detect the sources of E. coli, to see whether if we can actually identify that source. Because once you identify that source, if you can fix it, then you can save that environment and you can open it back. This study was done a couple of years ago, and we looked at the culture-based methods where EPA methodology recommended back then versus a human marker using this molecular method to see if we will be able to identify if it is coming from a human source or some other sources, because these bacteria can also come from other sources as well. When we identified the source, it was actually one of the buildings that was a toilet at the state park that had a septic system that was leaking into the river. And that was the main reason why they had been having these high levels of E. coli for so many years. The moment we reported that, public health department came in and they found the leak, they fixed it. Next week, when we went back for sampling, that bacteria was completely gone. So these kind of methodologies, not that they're only rapid, if you communicate and work well, you can actually solve these problems easily. Lately, we have been expanding this research to stormwater management. We have been partnering with City of Savannah, City of Huntsville, Chatham County as well, to see if the stormwater management can also be done using the source tracking methodology. So we've been partnering specifically with City of Savannah lately to identify whenever they see high levels of E. coli, is this really coming from some wildlife, some dogs around the parks, or is it a leaking sewer system that they can actually go ahead and fix? So we just started that project. We are really very excited about it because this is a better way also to invest and use funding of the municipalities as well. Moving forward, the Institute will continue its work at the coast, specifically collaborating with the universities, the communities, school systems, nonprofit organizations, health departments, and industry. What we envision moving forward is to use the water dashboard, how much water we have, look at some of the water quality data that's existing out there, and how we can actually start predicting towards when there's a major hurricane happens, when there's an issue, emergency happens, how the water is going to be impacted. Another project that we are working closely with the communities is just starting, is about implementing community testing sites. We have been working closely with Glynn County. Commissioner Booker has shown interest to start a publicly owned community testing site that they can be trained and do some water quality testing by themselves, but then being validated and making sure that the data is correct and quality controlled. And also, if there's a need to do advanced testing, they could also partner with certified labs. This is particularly important because for the people who are going to be trained will be the leaders for that community to be able to bring more awareness on water quality in the region. As we are working closely with the communities and municipalities in the region, we also realize that there is not a great distribution of capacity in our region in terms of water quality testing as well. This map here shows how many of the laboratories are capable of doing this kind of work, including wastewater surveillance, because once you have invested in this kind of testing capacities, you can also start looking at wastewater, looking at community disease spread by looking at their wastewater, because people shed most of these pathogens through their fecal matter and ends up in our water systems. So without people, for example, for COVID, you may have heard about this, many cities actually started to look at their wastewater before a spike happens in terms of COVID. Way before people start going into the hospitals, you can actually start seeing those spikes in the wastewater. We don't have any of that in this region. So one of the goals of the Institute is moving forward when we open up the laboratory in Savannah to be able to do that kind of testing and serving to the city of Savannah and the regional other collaborators. Well, I talked a lot about coastal water, surface water, and how we have been connecting with the communities. But one of the most important things that we should not be forgetting is our drinking water. And everything is connected here, right? Because our water comes from a groundwater system. That groundwater is impacted by climate change, by whatever is going on up in the surface, that eventually impacts drinking water systems as well. On top of that, we have all this aging infrastructure that also leaks into our water systems. Community water systems are one of those. According to one study, there are 18 million people actually that are served by community water systems are impacted by high levels of lead in their water because of the lead pipelines or junctions of the pipelines. They may all contain lead and can leach into the water. As you know, lead actually is the main cause of IQ reduction in children who are exposed to, and it's a preventable disease. So with the American Rescue Plan Act, there has been a lot of investment on getting the water infrastructure better, but that will take some time, and it will need more monitoring. It will need more assessment as these municipalities start changing their lead pipelines into PVC pipelines and other sources. What is not being completely worked about is the private wells, because 10 to 15% of the population is still under private wells. And because they're private, people actually are not necessarily being tested for the water quality for their private wells. We did one study earlier where we looked at how many people are actually testing their private wells, how many of them are aware that there might be these concerns in their groundwater systems. Only we found out that only 34% of the community actually tested their water. When it comes to treatment, whether it's chlorination or basic filtration, only 25% of them actually treated their water. So as you can see, there's also a lot of issues related to that needs to be communicated, and hopefully working with the public health departments and state agencies and working with the communities, most importantly, this kind of problems can be solved. One of the things that is going to change eventually is that how we look at water quality. Right now, the way we test water is really focusing on still fecal indicator bacteria, but there are so many other contaminants of concern. The current contaminant candidate list actually has 66 chemicals, 3 chemical groups, and 12 new microbes that needs to be closely monitored, and eventually some of them will make into the Safe Drinking Water Act amendments. meaning that they will have to be monitored more routinely. And like I said, a lot of these issues impact the vulnerable most. This is a picture on the left from a community who wanted their water to be tested. This is a kitchen tap. Some people have to live in these conditions that potentially has most of these emerging contaminants in the water that they have been exposed in their everyday lives. That's why it's extremely important to work with the communities to develop the research questions together before we even start taking an action. We're so excited about this new office that EPA launched, advancing environmental justice and civil rights. It will be an extremely important resource for us also moving forward as well, because most of the region here needs this kind of support. Like I said, water connects us all. Everything is so interconnected and intertwined. Our goal at IWH is try to focus on these issues and work with the communities for effective solutions. With that, thank you for listening.
Thank you so much. That was really, really interesting. I learned a lot. I think water is, sometimes people don't realize how amazing and valuable it is. So thank you so much. That was really interesting. Do we have any questions? You can unmute your microphone or feel free to put a question in the chat.
Hi, this is Ginger with the Coastal Health District, and I'm in the communications office. Can you guys hear me okay?
Yes.
Yes.
Okay. And I hope that I didn't miss this. I had to step off for a call for just a second, but I'm really interested in the possibility of getting a faster turnaround time for those beach advisories. So if they're, because it's our office works with the Coastal Resources Division of DNR to get out those press releases and announcements about the beach advisories. And that's one of the things that that I don't like about it is that by the time we, like you said, by the time we get the information out, the data or the sample is already, you know, pretty old. And so I would like to be able to give people faster access to the information that they need to make decisions about, you know, their recreation. So if there's anything that you need from public health, you know, anything that we can do to support your work there, please just let me know, because I would love to be able to get a faster turnaround for that.
Thank you so much, Ginger. And we have been working on a project with DNR to see if we could use the QPCR data. But to be able to do that, we had to go through a feasibility study as per EPA's requirements. And we completed that. I can share you that data with you if you'd like to, because if we can somehow, and a lot of the beaches that we tested, they are eligible for QPCR according to our data. So it's all, really, it all matters that there's the will to convert towards QPCR, because California did that, Chicago did that, Michigan did that. They collect, and they have more beaches, like 1,600 beaches. That's what Michigan has. They were able to convert to that and invest on that. And they actually report the same day. So I'm so glad that you are also on the same page with me. It needs to be moved forward.
Yeah, thank you. I'll send you a separate email and maybe get some of the information that you have so I can be an advocate in whatever way I can.
Thank you so much.
Thanks, Ginger. Dr. Telfair, did you have a question?
Yes. So so thank you for the presentation. It's really good to see but just even more clear where you're going with your work. So my question has to do with the intersection of your work and the environmental justice question, you know, which, as you know, recently the Warren County, you know, where it started, recently celebrated their, you know, the time some 50 some years ago. So what are your plans, if y'all have any, of that intersection out of your new institute, or is that something just right now part of the discussion? Thank you.
I'm so glad you asked that question. We actually just had a very productive meeting with Dr. Stacy Smallwood because he is heading the office there with environmental justice or justice in general. And we have great ideas moving forward with this, not just on research and grant applications, but also increasing our network of communities and really start collecting information more from the communities. So we're starting some listening sessions with some targeted communities about what are their immediate concerns about water and what can we do to help them. So we're going to really start from ground zero on that and really go build up on that. There has been some studies done at the coast, but they have been mostly for coastal water quality, not necessarily drinking. So there is a lot to be done, and I'm so glad that we have so many great partners and faculty that is interested in that.
That's great to know, and let us know if we can be of any help and support that work in any way.
Absolutely.
Thanks, Dr. Telfair. We do have a question in the chat regarding is the Institute only involved in testing within the United States?
Oh, that's a great question. Well, no. We actually have a partnership with Dr. Ana Palacios, who has been spearheading the work in Latin America. So moving forward, she and I and Stetson Roll from environmental engineering, 3 of us will be doing more research in that region. We already have started some work in my home country in Turkey as well. We have some partners that we have been doing work together on source tracking. We published recently together on source tracking and one of the estuaries that I grew with. It is moving forward on that end. But we need more people, so please join us.
Thank you so much. Any other questions?
Hey, this is Brant Phelps with the Coastal Health District. I just had a quick question. I may have missed it. I had to look at something else real quick. Did you mention what kind of, I know you mentioned private wells. Are there any projects as far as trying to increase those numbers of getting people, because we do well testing for private wells. I'm just wondering what kind of pushes or projects you had for trying to get information out to those folks so that they need to get their well tested.
Yeah, thank you for that question. So we have been working with Evans County CARES Foundation for a couple of years, even before the start of the Institute. That is to target the water quality testing in private wells in a very agricultural rural area. Moving forward, now we have a new community group from Glynn County that has some private wells, not all, that are also interested in that. One of the interventions we had, and that happened to be a dissertation study eventually by one of our students, has been to install and give away actually filters on taps and see whether people actually will install them or moving forward even continue using them. The data was small, so 64 data points, but what we've seen is if people installed it, they would like to use it. But again, this will not remove bacteria. We need to put a note on that. It will remove, though, a lot of these emerging contaminants that we just talked about, or arsenic or lead that we know that is potentially in the water. So we just need to do a little bit better on advocating for that, maybe creating more campaigns towards that so that people are aware and it's easy to use and keep doing it.
Thank you so much. Thanks, Brant. Any other questions?
This is Randall Ford. How are you today, Dr. Aslan?
I am great, Randall, Dr. Ford.
Thank you. You mentioned, and we talked about this in our water class, but you mentioned that what certain areas are not allowed to drill any new wells. I'm making an assumption, and I'd like you to confirm it, that if someone has an existing well and it has to be closed for some reason, there are provisions to allow a new well to be drilled to replace the older one. Is that correct?
That's correct. As long as they don't use the existing one and drill another one, that's correct. But this is mostly for public water systems. So if there's a community well, an owner that serves, let's say 50, hundreds of people, that you cannot have another one next to that. And that red zone is mostly around Savannah and Brunswick because of that saltwater intrusion concern. So the more you withdraw from the well, the more salt will come from the coastal side and go into that water resources. Bullock County is on green zone, but currently there is this conversation about this mega site, which there's a grand opening of that today, I believe. How that mega site will impact in Bryan County will impact that water resources, because they're going to start extracting water in 3 years from the green zones, which then potentially that green zone potentially turn into an orange zone, then eventually a red zone, meaning there's no water left for the communities. So there's a lot of discussion going on behind that to see if there are other alternatives, like can we not just depend on this finite source, but maybe use other technologies like reuse water. Can we like, for example, Singapore, we give that a lot in my class, Dr. Ford, if you remember, where it is 100% recycled water. So we're still relying on this pure water for industrial purposes, where all these other people actually need it for drinking. So I think moving forward, there will be a lot of discussions to be done in that area.
Thank you.
All right. Any other questions? We still have a little bit of time if anyone has a question. All right, well, hearing none, thank you so much, Dr. Aslan, for sharing all that information with us today. And folks, if you have colleagues that are interested in listening to this webinar, we will be posting a link in a few days on our website. So you can actually contact Brant if you need access to that. I'll make sure that he gets the link. So,
Thank you so much.
Yes, thank you all so much for joining us. Have a great day.
Thank